In more than half of stroke incidents, the brain sends a direct and unmistakable warning signal hours before the major event occurs. In some situations, the alert can appear a full day earlier. It is not a vague sensation or something difficult to identify. It is a real and recognizable sign. Yet most people either fail to notice it entirely, or they see the symptom, feel reassured once it disappears, and move on as if nothing happened. That sense of relief can become the most dangerous moment of all. For many people, a stroke is imagined as something sudden, like a switch turning off without notice. 1 second life feels normal, the next everything changes. But in most cases, that picture is inaccurate, and misunderstanding it has cost countless lives. Inside the body, the process often begins long before the actual emergency. The arteries carrying blood from the heart into the brain are not simple tubes. Their inner walls are alive and delicate. A thin layer of cells called the endothelium lines those vessels. When healthy, this lining allows blood to glide through smoothly. Nothing clings to the surface. The brain receives a stable and uninterrupted supply of fuel every second. But after years of elevated blood sugar, hypertension, smoking, and ongoing inflammation, that protective lining becomes damaged. It turns rough and uneven. Scar tissue develops. Cholesterol buildup and tiny blood clots begin attaching themselves to those injured areas. Little by little, the inside passage of the artery becomes narrower, not over days or weeks, over many years. For adults in their 50s, 60s, and 70s, this stage becomes especially dangerous. Once an artery has narrowed significantly, it grows unstable. Small plaque fragments may break loose. Tiny clots can form where the vessel is constricted. If one of those clots or fragments briefly limits blood flow to part of the brain, even for only a minute, a transient ischemic attack can occur. A TIA is temporary by definition. The blockage shifts, circulation resumes, and the symptom vanishes. That disappearance is exactly why it becomes so dangerous. The body seems normal again, and people convince themselves there is no problem. But a TIA is actually a severe warning that a major stroke may become statistically likely within the next 24 to 72 hours. Those hours create a narrow intervention window. Missing it can leave permanent consequences behind. One of the earliest warning signs often appears in the face. It can be subtle enough that people blame fatigue, stress, or aging. Someone stands in front of the bathroom mirror, smiles, or begins speaking, and something suddenly feels different. One side of the face may feel heavy, numb, or slightly drooped. A drink might leak from one corner of the mouth. A strange imbalance appears that did not exist the day before. What is happening inside the brain is a temporary reduction in blood flow to the motor control region responsible for facial movement. Because each side of the brain controls the opposite side of the face, reduced circulation in the left hemisphere affects the right side of the face, and the reverse is also true. With a TIA, blood flow interruption is temporary. Symptoms may disappear after 5 to 15 minutes. Everything seems normal again, and the moment gets dismissed. There is a simple facial check people should remember. Smile and observe whether one side moves less than the other. Raise both eyebrows and see if one side lifts lower. Speak a sentence aloud and listen carefully for slurred or unclear speech, even if it is slight. If any of these signs suddenly appear and then disappear within 10 minutes, it should still be treated as a neurological emergency requiring same-day medical attention. Another warning sign involves the arm. This is different from the ordinary sensation of an arm falling asleep after being compressed during sleep. In that common situation, tingling and heaviness fade quickly once movement returns. A pre-stroke symptom feels different. Someone may be sitting normally without pressure on the arm, when sudden weakness appears on one side only. The arm can feel heavy, difficult to raise, or strangely numb. Sometimes pins and needles develop without any clear physical reason. Inside the brain, the motor cortex responsible for arm movement is temporarily losing blood supply on one side. Communication between the brain and arm becomes interrupted. The problem is not in the arm itself. The issue begins in the brain's signaling system. Because the symptom may fade within minutes, many people dismiss it as overexertion or poor sleep posture. But weakness affecting one arm during rest should never be ignored, especially when it resolves on its own. Another warning sign affects speech and language. This symptom can feel deeply unsettling. During conversation, a person may suddenly lose access to a word entirely. This is not the normal experience of struggling briefly to remember a name or phrase. Instead, the wrong words emerge. Sentences become scrambled. The person may realize something is incorrect yet feel unable to fix it. Sometimes words fail to come out at all. The experience often causes embarrassment rather than fear, and that reaction can become dangerous because it delays urgent medical attention. Sometimes another person is speaking to you, maybe a spouse, a grandchild, or a close friend, and although you hear the sound of their voice, the meaning no longer connects. The words arrive, but comprehension disappears. Inside the brain, two separate language centers manage communication. One controls speech production, the other handles understanding. For most people, both are located mainly in the left hemisphere, and both depend heavily on branches of the middle cerebral artery. When circulation to either area becomes interrupted, even briefly, language problems appear exactly in these forms. Speech may become confused. Understanding may vanish. Once blood flow returns, the symptoms fade within minutes. That temporary recovery causes many older adults to dismiss the episode as fatigue, aging, or a harmless senior lapse. That mistake should never happen. A sudden inability to speak clearly or understand language, even if it lasts only 2 or 3 minutes, is considered by neurology to be one of the clearest warning indicators of an approaching stroke. Pay close attention if words suddenly become incorrect, disappear entirely, or come out scrambled when they were perfectly normal moments earlier. If that happens, medical evaluation should happen the same day. Another major warning sign involves vision. Many people close one eye, notice something unusual, and assume tiredness is responsible. But stroke-related visual symptoms generally fall into 2 distinct categories, and each points toward a different problem inside the brain and blood vessels. The first warning sign is darkness affecting one eye. Not blurred vision, not double vision. Instead, one eye suddenly becomes dimmer, as though someone lowered a light switch only on that side. Most often, the episode lasts less than 1 minute before normal vision returns. This happens when a tiny clot or plaque particle from the carotid artery in the neck travels upward and briefly blocks the small artery supplying the retina. The retina, positioned at the back of the eye, functions as light-sensitive tissue directly connected to the brain. The same arterial system feeding the brain also supplies the eye. That means if a clot can reach the eye artery, the next destination may easily become a brain artery. The second visual symptom feels even more alarming. Sudden double vision may appear. In other cases, a person loses sight in the same half of the visual field in both eyes simultaneously. This differs completely from one eye temporarily darkening. That pattern usually points toward reduced blood flow in the occipital lobe at the back of the brain. The occipital lobe processes and assembles visual information coming from both eyes into the image a person sees. Both types of vision disturbance become medical emergencies when they appear suddenly, persist for several minutes, and then disappear. This is not something to postpone until next week with an eye appointment. It should not be brushed aside by reassurance from friends. Same-day medical evaluation matters, and if other neurological symptoms appear together with the vision change, an immediate emergency department visit becomes necessary. In adults over 60, these visual disturbances are among the most overlooked warning signs before stroke, because people often blame eye strain or outdated glasses prescriptions. Another highly misunderstood symptom involves balance. An older adult may walk through a familiar room and suddenly realize something feels wrong. The foot lands awkwardly. The body drifts slightly to one side. A hand reaches toward the wall for support. Sometimes the person is sitting completely still when an intense spinning sensation strikes without warning. It is not mild dizziness developing gradually. The room suddenly feels as though it is violently moving. The cerebellum controls balance and coordination. Located at the base of the skull, it constantly receives information from the eyes, inner ears, and joints to track the body's position in space. Using all of that incoming information, it fine-tunes movement so a person walks straight, reaches accurately, and remains upright. The cerebellum receives blood through a completely different arterial network from the front of the brain. These vessels, called the vertebral arteries, travel upward through the bones of the neck and are vulnerable to narrowing and clot formation as well. When blood flow through those arteries suddenly drops, even briefly, the cerebellum effectively loses its incoming signals. The result is abrupt imbalance or severe vertigo with no obvious trigger. The person did not stand too quickly. They did not move their head suddenly. They did not roll over in bed. Balance problems and dizziness are common in older adults, and many different causes exist. including inner ear disorders, dehydration, and medication side effects. But there is an important distinction. When vertigo appears together with slurred speech, vision changes, or numbness affecting one side of the body, it no longer points toward a simple ear problem. That combination, especially when appearing together for the first time, represents a neurological emergency requiring imaging and urgent evaluation instead of a wait-and-see approach. Even if a brief, unexplained balance episode happened months ago and disappeared within minutes, it still deserves discussion with a physician, because the next event may not disappear so quickly. Earlier, arm weakness was mentioned as an important warning sign. It becomes even more concerning when paired with other symptoms. Neurologists pay especially close attention when two or more warning signs appear together within the same time period, even briefly. One-sided arm weakness combined with slurred speech. Vision suddenly darkening in one eye together with an unusual headache. Abrupt balance loss occurring alongside facial drooping. When symptoms begin stacking together, the situation stops being uncertain. Those combinations point toward a specific blood vessel territory inside the brain that is under serious stress. In stroke medicine, the rule is direct. If symptoms from two or more of these categories appear simultaneously, emergency services should be contacted immediately, even when the symptoms are beginning to fade. The reason is critical. Inside the hospital, imaging tests can still reveal which blood vessels remain in danger, even after symptoms disappear. Doctors can identify plaque, measure narrowing, and in many situations intervene before a full blockage develops. The 72-hour period after any of these warning signs is considered the most important opportunity for stroke prevention, yet many people never use that window. There is also an important reason these events become more common after the age of 55. As the body ages, damage to arterial walls accelerates under the same risk factors. Elevated blood sugar that caused relatively slow injury during a person's 40s produces much greater yearly damage in the 60s. Blood pressure that blood vessels partly tolerated at 45 creates more stress and greater plaque instability at 65. One major process involved is endothelial dysfunction. Earlier, the artery lining was described as a smooth, non-stick surface. With aging, that inner lining gradually loses its ability to properly regulate blood vessel tension. Healthy arteries naturally widen when more blood flow is required. They narrow when pressure needs adjustment. And aging and damaged endothelium slowly loses that flexibility. As arteries age and harden, they gradually lose flexibility. Once plaque buildup narrows those vessels, the combination creates the classic conditions that can lead directly to stroke. Another important process happens during sleep. At night, blood pressure normally falls by around 10 to 20%. For most people, this drop is healthy and expected. But in an older adult whose artery has already become severely narrowed by plaque, that nighttime reduction in pressure can push blood flow through the restricted area close to zero. If a small clot has formed there during the day's inactivity, circulation may stop entirely. This helps explain a pattern doctors encounter frequently. Someone goes to sleep feeling normal, then wakes unable to speak or move. Sometimes a family member discovers them already showing stroke symptoms. The event often does not occur during activity or movement. It happens quietly overnight while blood pressure falls and the already narrowed artery can no longer maintain adequate circulation. That is why evening or overnight symptoms should never be dismissed as simple grogginess or sleeping in an awkward position. If any warning sign described earlier has already happened to you, even months ago, there are 3 specific conversations worth having with your doctor. The first concerns a carotid ultrasound. This non-invasive imaging exam uses sound waves to examine the carotid arteries in the neck. It measures both the structure of the vessels and the pattern and speed of blood moving through them. A duplex carotid ultrasound provides more than a simple image. It shows both anatomy and function. If plaque has reduced a carotid artery by more than 70%, that narrowing is considered hemodynamically significant, meaning blood flow may already be dangerously compromised. Knowing this gives doctors a clearer understanding of what steps may be needed next. The second discussion involves a hemoglobin A1C blood test. This is different from a standard fasting blood sugar measurement taken in the morning. Hemoglobin A1C reflects average blood sugar levels across the previous 3 months by measuring how much glucose has attached itself to red blood cells. A single healthy day before testing cannot hide the result. The test reveals how blood sugar has truly behaved over time. This is especially important because prediabetes often damages artery walls silently, long before symptoms appear. In adults older than 55, prediabetes can remain undetected for years. The third conversation should involve a 24-hour cardiac rhythm monitor known as a Holter monitor. Certain dangerous rhythm disorders appear unpredictably and disappear just as quickly. One of the most important is atrial fibrillation. During atrial fibrillation, the upper chambers of the heart stop beating in an organized rhythm and begin quivering chaotically instead. When that happens, blood no longer flows efficiently. It pools and swirls inside the heart. Within that stagnant blood, clots can develop. If one of those clots travels upward into the brain, it may block an artery there. This type of event is called a cardioembolic stroke, and it is often severe. Many older adults experience intermittent atrial fibrillation that lasts only a few minutes per day. A brief office ECG lasting 10 seconds may completely miss it. A 24-hour monitor is far more likely to detect those hidden episodes. If atrial fibrillation is discovered, medications are available that may lower stroke risk by 60 to 70%. Together, these three evaluations, carotid ultrasound, hemoglobin A1C testing, and Holter monitoring, help doctors identify three of the most common underlying causes of stroke in adults older than 55. If any warning signs discussed earlier sound familiar, these are the specific tests worth asking about. There is also a correct way to respond when a possible TIA or stroke warning appears. Driving yourself is not safe. Even mild neurological symptoms can already impair coordination, reaction time, and awareness. A few seconds of reduced arm control or blurred vision at highway speed can threaten not only your life, but everyone nearby. Planning ahead matters. Talk with family members or people in your household now. Decide who to call and who can respond quickly if symptoms appear. Do not take blood-thinning medication on your own initiative. Many people immediately reach for aspirin because they associate it with heart attacks. But stroke is different. There are two major forms of stroke. One results from a blocked blood vessel. The other comes from bleeding inside the brain. Blood-thinning medication may help in one situation and become catastrophic in the other. Only hospital imaging, such as a CT scan, can determine which type is occurring. Body position also matters while waiting for emergency help. Lying flat with the legs slightly elevated can help support blood flow to the brain without placing additional strain on the heart. The head should remain neutral, not sharply bent forward or tilted backward. Excessive heat should also be avoided. A very hot shower, a hot bath, or extreme environmental heat can widen blood vessels suddenly, and an unstable circulation that may worsen the condition. Another practical step is preparing a medication list in advance. Emergency teams lose valuable minutes trying to identify which medications a patient takes. A written list kept in an accessible place, or even a photograph stored on a phone, can save critical time and directly affect treatment decisions during the first moments of care. Stroke remains the second leading cause of death worldwide. It is also among the leading causes of long-term disability across the globe. In most situations, warning signs appear before the major event arrives. Sometimes the body sends those signals for several hours, sometimes for a full day or longer. The major symptoms to recognize are clear: facial numbness or drooping affecting one side even briefly, unexpected weakness in one arm during rest, a sudden inability to speak properly or understand language, temporary visual disturbances including one eye going dark, double vision, or loss of part of the visual field in both eyes, sudden balance failure or severe vertigo appearing without any obvious trigger or previous history. When these symptoms appear together, the situation becomes even more urgent. The hours following a warning episode are the key intervention window. The three important evaluations worth discussing with a physician are duplex carotid ultrasound, hemoglobin A1C testing, and 24-hour Holter monitoring. The stroke that never happens usually receives no attention. There is no dramatic moment, no headline, no visible rescue. Life simply continues normally. The brain keeps functioning. Walking continues. Conversations with loved ones continue. That quiet, ordinary future is exactly what early recognition is meant to protect. Write these warning signs down. Share this information with someone older than 55 who may benefit from hearing it. And if any symptom described today matches something you have already experienced, do not allow another week to pass before discussing it with your doctor. Your brain is the only one you will ever have. Protect it carefully. Please leave your thoughts about this content in the comments below. Thanks for watching. See you in the next one.